and humorous exploration of what it takes to really feel better. I'm Sandi, here with my co-host Dan, and today I'm sharing my why for doing this podcast. My health journey has been long, messy, and honestly sometimes brutal. Chronic pain for 30 plus years, a rheumatoid arthritis diagnosis at 18, multiple surgeries, meds that have helped and hurt, and a nervous system that learned some unhelpful tricks along the way. I'm telling this story because if you've ever felt dismissed, confused, or alone in your symptoms, you're not crazy, and you're not alone. We'll talk setbacks, little wins, the mind-body work that's changing how I heal, and why I believe turning a lifetime of struggle into service can actually matter. Okay, for the boring stuff. Quick disclaimer. The Health Hunt podcast is for informational and entertainment purposes only. We are not medical professionals, and nothing shared should be considered medical advice. Always consult your healthcare provider before making any changes to your health. Okay, deep breath, let's settle in, and let's get into it. So I want to share my why, and some of that obviously will be my health story, but for me, the why is really important, and I realize it may sound a little bit cheesy, but one of my motivations for doing this podcast is that my health journey has been really long and arduous and truly frustrating a lot of the time, but I've learned so much. And again, I'm going to talk about this in a few minutes, but I've had chronic pain for over 30 years now. And so it feels meaningful to me if I can turn a lifetime of suffering into my life's work and helping others. And so I think by sharing some of this, there is a point of connection. There's maybe useful information that people can glean from my story. And so that's really sort of why I'm doing this. So as I mentioned, the chronic pain. So I've had this chronic pain for over 30 years now, but even, and I think it's really shaped a lot of who I am and how I experience the world, or sort of more notably how I don't, because I often have a fear of committing to things or doing things because I'm so afraid that I'm not going to feel well. And that sort of fear will perpetrate some of the symptoms, which again, we'll talk about separately. But, it's important for me. And I want to, again, another thing that I want to share is that the things I'm going to tell you, I don't see this as I'm a victim. I don't have a poor me mentality. I actually tend to diminish my experiences because I think that there's people that have it much worse. I don't have cancer. I don't have life-threatening diseases. I can still function for the most part. And so again, I'm sharing this more for the point of connection and for education. So as a child, looking back, and this is related to some of the work that I've been sort of doing recently. I'm mentioning this because I think it's important. And again, we'll talk about it, but I had a lot of health issues. It started with ear infections as a baby. I sort of got every cold or virus you could ever get. And so with the ear infections, I was on a lot of antibiotics for a significant part of my early development life. I had a lot of fatigue, exhaustion, anxiety. I seemed like I had a weak immune system again because I was sort of, if there was something to get, I was going to get it, and I was going to get it 10 times worse than anybody else. That was the case with the chicken pox, with the flu, with a cold that somebody next to me would get. I'd be sick for weeks. I got the measles even in high school, even though I had, multiple vaccines. It was horrible. I was like 16 years old. And a lot of things that, there'd be symptoms, but nobody sort of knew what to do with. And Is
any of the things, because you seemed like you said if there was something to get, you got it.
Yeah.
And if you got it, you maybe had like the worst of it.
Yeah.
Is there a basis for that? Or do you think it's just like, is there anything like there? Is there a there?
Well, I think that the ear infections, obviously with antibiotics at such a young age, really can diminish your ability to fight off other infections, right? You're on antibiotics all the time. And so, I don't know. Obviously I think that there's some kind of correlation. All of that sort of created a perfect storm. And I'm mentioning this because later I'm going to talk about mind-body work. And I believe actually that a lot of the ear infections and some of the things that I would get were my body's way of responding to different things in my environment. So I'm not going to get into the details of that now. I think that'll be a whole other episode, but I'm pretty confident that there's a correlation between all of that. And so, and the next thing I'm going to share is about when I was, and it's, I was also a very active kid. Like we talked about, I grew up in the country. I was horseback riding. I was figure skating. I was a dancer. I did all of the things. I played baseball. So I was a very active kid, but I wasn't very strong. And I had a lot of downtime with these various illnesses. And so when I was about 12 years old, I spent 9 months dealing with some sort of virus that, they would tell you was kind of like chronic fatigue syndrome. This is what the doctors told me, and I believe they were experts, but they weren't actually able to look at the blood work and mark it out to a specific thing. So I think chronic fatigue syndrome is like Epstein-Barr. They could see that my white blood cell counts were very low. I was exhausted. I was nauseous. I just didn't feel good. I was getting various infections, but they didn't really know what it was. And so that really was difficult, right? Because again, especially at that age, you're taught to listen to doctors. And so when you go to a doctor and they say, well, we think something's wrong with you, but we don't know what. You don't even know where to go from there. And so it was, like I said, it was about a 9-month struggle. And, I believe now that there was a significant portion of it that was psychosomatic, because one of the symptoms that I had was nausea. And I developed this fear, even though it never happened, I developed this fear of throwing up. And so I'd be in school and I'd start to feel nauseous and I'd panic and I'd call my mom and I'd go home. And that sort of then turned into kind of a system of like agoraphobia, right? I just didn't want to go anywhere. And if I'd go somewhere, if I had to go to a restaurant or something, I always had an exit plan. It really took over my life. And, I went to a chiropractor because I'd actually had previous to this, and I think maybe it's a bit of a catalyst, but who knows? I'd had 2 very bad horseback riding accidents. One, I don't know, where was I? We were trail riding in North Carolina or something, and it was a boring trail, and I wanted to run with the horse, so I took it. It didn't like to be out of its line. It stayed back. It stood up and fell over on me. And then a couple months later, I was supposed to be doing some competitive show competition, and I was using my horse's pony because she was small. I had to be able to vault onto the back of her, and I don't know why that's something you encourage a child to do, but that was part of it. And this horse didn't like me, and she ran away, and I fell off and got a concussion. And so I think this sort of like preceded some of the illnesses that came up and some of the symptoms that I was having. So I went to a chiropractor because I was having various stomach issues, and he told me I was out of alignment. So he used to move one of my vertebrae that connected to my stomach, and then I'd feel better for a couple of days and it would come back. So I kind of dealt with this for like 9 months. And again, I could probably do a whole episode on this, but I'm going to sound like a crazy person. I cured myself overnight. At some point, I decided that this was enough and I didn't want to live this way anymore. And I remember laying in bed and I just decided I was going to wake up feeling better. And I had this like weird fever that night. And then I woke up and I was like, I think I'm better. It was actually today, August 3rd. I think it was August 2nd when I was 13. So 30 something years ago.
Question for you, just so everyone understands, even for my clarification, you were having all these symptoms and dealing with all these chronic issues while also being very active. Like, were there 2 sides to this? Like the horseback riding?
Well, I think everything stopped. Well, first of all, I was actually never able to ride again. I was so afraid of being on a horse because of these 2 incidents that happened close together where I lost control. And so I had this sort of mental block that I couldn't control horses. And so I tried to ride again and I couldn't. I was still dancing, but they were sort of making concessions. I wouldn't really, first of all, it was a small town and I was one of the older kids. So I was good for the small town, but I was certainly never going to be on So You Think You Can Dance. And this will also tie into things that happened later. But so I was still doing some of these things, but probably to a lesser degree. Like if I would dance, I wouldn't be doing it full out. I would just sort of walk through the choreography and just have to take a bit of a break. But then, like I said, I healed myself. And so that's why I believe that I don't know where the actual illness, if it was a virus, started and then where the psychosomatic stuff took over. But I know that there is a correlation. And so again, we'll be exploring this. Let's fast forward a little bit. And I just want to mention this because again, it'll tie into the mind body. I was a very, very high strung kid. I, was sort of the consummate perfectionist. I think my identity was that I was the smart kid. And so when that happens, the amount of pressure that I put on myself to never fall from grace in that respect was almost overwhelming. Every test was a potential point of failure. And so I sort of lived in this state where life was almost terrifying because if you're perfect, there's nowhere to go but down. And so when I was 18, my last year of high school, I started having pain and swelling in my right elbow. And for a while, I actually just thought it was from water skiing because for my 18th birthday, I decided I needed new water skis. We had a cottage on the lake. And so we'd go there every summer. And I got a purple wetsuit that I thought was like the coolest thing that anybody could ever in life have. And so I was water skiing. And so I just thought that the pain in the elbow was from the water skiing. I eventually went to a doctor who labeled it as bursitis. And then when it didn't go away, they did more blood tests and they told me I had rheumatoid arthritis. And so this was like a horrible shock, right? Because especially back then before the internet and things like that, I mean, I knew rheumatoid arthritis as an old people disease. And so it was terrifying. And they don't prepare you. I mean, the doctors just say, this is what you have, and then it very quickly, I think once I got that diagnosis, it very quickly started to move around to other joints. I felt like my body was stuck, like it hated me. And it was so debilitating at times that I couldn't get out of bed without the assistance of my parents. That was primarily the swelling in my knees, but I remember I would try and get out of bed and I physically couldn't move. And like I said, I'd been an active kid even with the sort of other illnesses. And so this was a very difficult thing and it was very scary.
So I have a question. The rheumatoid arthritis first showed its gnarly face in your elbow.
Yeah.
Right?
And I actually still can't straighten my elbow. It never got better. And for a while, they would give me injections and put me in this weird brace that I'd have to sleep with my arm out so I couldn't bend it. I walked around with my hand sort of like in my pocket because I couldn't actually straighten my elbow. And to be honest, I just showed you, I still can't straighten it. I never got range of motion back.
And then from that diagnosis to what you mentioned as all of like the other symptomatic parts of your body that were then, showing up, like, was that, is that how it works? Like, does it soon thereafter all these other things show up, or is there some type of mental part of that, or how does that?
Well, that's the thing, right? And so I'm kind of going to get into this, but there is for sure an emotional component to arthritis, and they don't know. So this is sort of where this is where the journey really started for me, and why I had to do my own research and sort of like advocate for my own health. Because like in case a diagnosis like this isn't traumatizing enough, I was told by doctors, and again, back then, you doctors, they're medical professionals, that they tell you something, they're supposed to be the authorities. I believed that they knew a lot about the body. But I was told that rheumatoid arthritis, and this will like stick with me forever, that rheumatoid arthritis had no cure, and it was something I could expect to live with for the rest of my life. And the kicker was that they didn't know why it started for anybody. And I was told that my body was essentially attacking itself, and more specifically, my joints. And nobody knew why. And this is just how I was going to have to live.
So is this a function of the time that this happened, like the decade? Was it a function of not seeing the best medical care, or is it actually just a function of traditional medicine going wrong?
No, this to me is, and again, I don't want to say negative things about doctors, but I think from most specifically rheumatology, which is the specialty of rheumatoid arthritis and other sort of similar autoimmune diseases, which again, autoimmune disease is, in theory, your body is attacking itself for no reason that they know of. And so, I was curious before we started working on this podcast, I was curious to see if the description of rheumatoid arthritis has changed at all. And it has not. They still don't know the cause. And over the years, I've seen various rheumatologists. It's sort of the same thing, And so it was this weird, like, there's no reason kind of thing. But like, don't worry, because we have lots of drugs for that. And again, like, this was before Google, but I sort of knew that made no sense, right? This was not a diagnosis that I was willing to accept, because why would your body attack itself? So really, this is where the deep dive into, I need to understand my own body and not just listen to a doctor that says something is wrong with you. We don't know why you have it and we can't fix it, but we'll treat your symptoms. Because that was like very bothersome to me. And I was a kid, again, as this type of kid that I was, I needed to understand things. Even now, if you tell me something and I don't understand it, I need to seek out why. I need to understand exactly what's happening. So that just didn't sit with me. And just as an example, and again, even as a kid, like, I know that if I cut my finger, the skin's going to grow back together and it's going to heal. Our bodies are designed to function in a certain way. And so the way that they were describing arthritis to me was just not something that my brain was willing to accept. And so really, that's like, for me, that's where my health hunt began. And this is just another thing I wanted to mention. And this is one of those like trust your gut things for anyone who's listening, because I remember, again, at 18 years old, sitting in the waiting room of endless doctor's appointments, primarily rheumatologists, and looking around. And the only reason I was going is because they'd give me one medication and it wouldn't work, and then they'd give me another one. And so there was nothing for them to check except to like change the Band-Aid that they were putting on it. And I remember just looking around the room and seeing all of these like decrepit, miserable people. And they're all in the doctor's office. So typically if you go to the doctor, people are sick, but this is a little bit different, right? Because they're there to treat something that's already been diagnosed. And I just remember thinking, like, these experts are not helping anyone. And they just looked so defeated. And I could see some of the physical deformities for people that had it for a long time. And I just, it was terrifying, but I wasn't willing to accept it at face value. So some people might see a scene like this and think like, they were right. The doctors are right. You've got something, can't fix it. We can only treat it. There's no cure for it. But what I sort of concluded was that not that there was no solution, but simply that I needed to look for a different solution. And, this is where we kind of start deviating from unconventional treatments that are sort of, accepted as the norm in standard medicine. And, even though like I didn't fully buy into the diagnosis, I still needed relief at the time. And so while doing other research, and again, to my parents' credit, without the internet, they were sort of doing their own research. And so I did a lot of very weird things. And I still don't know to this day how my mother found this lady, but she took me to see this very old woman. I'm just going to tell this one story because so out there. But my mom took me to see this very old woman. I think she was in her 80s and she was this tiny little human. And her thing was that she channeled an ancient Egyptian pharaoh. And so she would do this thing where she would like drink some water and take a deep breath and let this pharaoh enter her body. And then she performed this, like, I don't know, some kind of ritualistic massage on me, I guess, to get whatever was out. I don't know what the theory was that she was doing. But she was so strong and her face looked completely different. And it was the wildest thing ever. I mean, she was so strong, I was in pain. And so at the end, she then told me that there was someone there with yellow roses. And so anyway, she basically described my great-grandmother. But it didn't help. But it was, again, this I think will probably give the listeners an idea of what I am open to trying for my health. I have not since then sought someone out that does this, but.
What year was that?
I want to say like 1994, 93, 94.
Your mother, was that more like a phone book thing or the Google? I don't remember when Google started. Like probably.
Oh. Yeah. So this was like in the mid 90s. And I don't think this was a phone book thing. I think somebody had told my mom about this lady. I have to ask her. I don't think she remembers, but.
Well, this is a really, really good story. Before I forget, I think it's really always interesting, and this is kind of like a issue that I have, is doctor's office waiting rooms. You painted a picture of one with all of the old people that were already diagnosed with something that looked sickly and whatever else they were.
Defeated.
I've walked into countless waiting rooms. Like, I'm sure everyone can knows when they walk in to get lab work done. They walk into this weird calling of society where it's a weird bunch of people. Everyone's there getting lab results for whatever reason, or lab work for whatever reason. Or you walk into a doctor's office for, I am very preventive. I'm very into my cardio health. And so I walk into a cardiologist and you see like just what you'd think you'd see. So I just think like that seemed like a very dark waiting room to be in for you.
It was. And I guess I was a perceptive kid, but it was just, it reinforced what they were saying, but also that like, what was the point of even being there if they weren't helping anybody? It kind of reminds me of, in Beetlejuice when they first die and they're waiting to talk to the receptionist and they're they're not fully aware yet that they're dead. And then they find out and they don't know what's going on. It was kind of akin to that. So
it's a super funny reference because, again, we're talking about, for people who are our age, we're talking about the original Beetlejuice, not the newest movie that one came out. Maybe it's in there too, but I remember.
I think it's in there too. I think that's probably where. But
you walk in and like I remember clearly as a kid when I first saw it, and you see one guy in the waiting room who's like a huge guy with this shrunken head.
Yeah.
And I feel like when I walk into any waiting room anywhere now, I always like think of that picture. So funny.
Yeah. Okay, so the next part of the story, like I said, I did accept the traditional medical model because I was in pain. And so while I was also, didn't want to acknowledge what was going on, and I was sort of seeking other methods, in the meantime, I needed to be able to function. It was my last year of high school. I was still a very avid dancer. And so I was having different medications. Some of them made me so loopy I couldn't read. And then they started giving me various types of injections. So the one that, and this is where I wish that there was internet or we had done more research, but because I was a dancer, and again, I was not so good. This was not if I had known what the consequences were going to be of this, I would certainly have ruled it out. But at the time, they said it was fine and it was okay. So I was getting a mix. And so at one point, I guess towards the end of when I was 18, I had this horrible hip pain. And at first I thought it was like a pulled muscle from stretching from dancing, but it just didn't go away. And so we investigated that and they told me it was the arthritis. So they said, well, we can help you dance. Cool. Sounds great. So I would get a mix of cortisone, which is a steroid, and radiation. Radiation where I would have to go to the hospital and they would put me under an x-ray machine and they would take this needle this long and they would inject it into my hip. And then they would say, so you can't really move around for 3 days because we don't want the radiation to travel. And so I would be on crutches for like 3 days, being very careful not to move my hip joint. And I did this a number of times.
How did you not challenge this based on what you said before? Like, how was this not the notion of these shots not challenged by you?
Well, I mean, I would challenge it now. But again, back then, I just wanted relief. And I think if you're in, and this is one of the reasons that I want to talk about chronic pain at some point, in part because, I didn't look up the statistics before I jumped on here, but there's millions and millions of people in chronic pain. And it's very isolating because on the surface, you look fine. If you have the flu and you're sneezing and coughing and whatever, you look terrible and people know you're sick. But when you have a chronic pain, it's just inside. And so sure, maybe they can tell you're not walking properly, but you look fine. And so the expectation is that you're fine. It can be very isolating because you can't walk around going, hey, I'm in pain, leave me alone. Like you just, you have to function. Well, I do that sometimes, but that's not really the way that you get around in life. And so I know this from talking to other people with chronic pain. It's very isolating. It's there all of the time and it's exhausting. I mean, for me, I still have pain. Everything I do, like even brushing my teeth, holding things a certain way, of taking a step, everything there's pain. And so that can be an isolating thing. And so I'm hoping that people, when they listen to this, understand that there's somebody and other people, millions of people out there that understand what they're going through. But the point is that you're just looking for relief. Dancing was something that I loved. And so I wanted to be able to dance. Again, I was competing a little bit, but I was not that good. And so sometimes if somebody offers you, would you think that you would get injections in your neck? Right? Like you're just looking for relief. And,
no, it was a big step for me. So I totally understand where you're going. I totally get what you're saying.
And again, this is before, I was doing my own research. I mean, we were doing research, but it didn't mean that I didn't want to function in the interim. And so we did these and they would give me some relief. But for me, cortisone never really lasts that long. But a few things happened. Also, and then when I was in university, they gave me this drug called methotrexate, and it's a cancer drug. So what the drugs for arthritis, because your immune system is hyperactive, they're designed to slow down your immune system. So for anyone who knows what an immune system does, you would know that is a horrible thing to do. And so that kind of perpetrated more sickness and illness because my immune system was shut down. But I guess the result, so not only that, I mean, I would, I had some weird illness where my throat closed up right when I was supposed to take exams in university because I was so sick from who knows what. But I just had my immune system was completely destroyed. So I want to just quickly talk about, I sort of mentioned the isolating effect, but the emotional toll that being in chronic pain takes is immense. It's hard to think about anything else when every step that you take is painful. And so I wasn't an incredibly social teenager, but I was still missing out on a lot of social activities. I would sometimes drag myself out, but I just didn't ever feel good. And I remember feeling sad and depressed and just overall miserable, especially with a diagnosis that you're told is never going to go away. And I noticed, and I think I probably even noticed it back then, that my symptoms would get significantly worse around high stress times. So like exams or applying to university or things like that. And again, this is mind-body component that I understand now that we'll talk about in a future episode. But actually, when you look up arthritis, even like the arthritis community will acknowledge that stress can play a factor in the severity of the symptoms. So then fast forward.
So is that mental or is that physical, like that stress? Is it like a mental toll that kicks it off into some psychosomatic form, or is it like just actually stress, physical, direct correlation?
No, and this is, I mean, I don't want to get too deep into this on sort of, I've been doing in the last 5 to 6 months sort of work on the mind-body connection. And the way that, I'll just, as an example, I know now that the arthritis was my body's way of giving me a pass and getting me an out. Because I was such a high stress kid, the only time, and most people know this, the only time that you really sort of get a pass in life is if you're really, really sick. People kind of know to you don't have to be operating at the same capacity that you normally are. People have lower expectations, which means you can have lower expectations of yourself. And I think that the development of the arthritis was sort of a manifestation where my brain told my body that I needed an out. And I don't want to get too deep into this because it's going to sound like I'm saying it was in my head. There's very significant research that says that it's not something that you made up in your head, but there is a correlation between how you feel about things and then it manifesting in your body. Again, that's a whole episode. I don't want to get too deep into it right now, but it's like fascinating stuff. And so let's fast forward a bit and we'll tell you why I should not have been getting those insane radiation cortisone injections. When I was 20 years old, I needed a hip replacement. And so I actually spent my whole first and second year of university in extreme pain with my hip. I was taking painkillers. I'd stopped sort of getting injections because they weren't really helping me. But the way that I found out about the hip is that I was supposed to go visit my grandparents in Florida. One of my friends was going to come and I was like, you know what? I just want to have a good time. I'm going to go get a cortisone shot so I can get a week of relief and enjoy my vacation. So I went to the rheumatologist was like where my school was. So he hadn't seen me before. So he did a series of x-rays and, his background stuff. And that night he called me at home at 9:00. So it's very alarming when a doctor calls you at your home at 9:00. And B, he said, there's no point in giving you a cortisone injection because there's nothing to inject. Meaning that at that point, the lining that usually sort of buffers your joint and like the bone was gone. So I just had bone on bone. And that's why I'd been in so much pain. So, they don't like to do hip replacements or any kind of joint replacements on people that are younger because those replacements typically have a shelf life. I was 20. And so I wasn't going to wait until I was 70 or 80 to have it done because I needed some quality of life. So we went ahead and we scheduled a hip replacement. I don't regret doing it because I was in so much pain and it was the surgery itself is a little bit complicated, but especially back then, but I got a significant amount of relief from it and I was pretty much recovered after about 6 weeks.
So I have a question. Hip replacements, common procedure, obviously in older adults, or I'm sure maybe it expands the spectrum of ages, but caused by the injections you mentioned prior.
Well, that's the belief, but also arthritis, the inflammation from arthritis can also eat away at the joint and the lining and things. So it's
got it. So you were 20 when you got this hip replacement, and so you mentioned shelf life. Like, will you need another one, or how is that going, and how are you feeling about just where you're at with that?
Well, they said 10 to 15 years, but like I'm almost 30 years in. It's still fine.
So the only way you would know if you need another one by symptoms, or would you get it like x-rayed again? They'd tell you.
I've had it x-rayed. They didn't say anything about it. I think this was like a long time ago. I think I would know. It probably would just be, again, painful. So it's not something I worry about because if I need it, I need it, right? I mean, I'm not.
Got it.
But it was for that particular scenario. I mean, I was out of bed. I was weight bearing the day after. I mean, there's been a lot of upgrades in that surgery, but even back then, it was pretty benign in terms of like how difficult it was. Now, fast forward, I actually had a knee replacement a couple of years later, bionic on one side, but that was much harder. And it's partly because I'd been in a car accident. It's a very long story that I will save you from, but in the UK. And so I completely shattered the femur, crushed the knee. They put it back together with a bunch of like Home Depot. I'm joking, but they gave them to me eventually when they took them out, but they look like Home Depot screws. And I never got range of motion back. I only have about 90 degrees. And 2 years sort of after that had happened, I was in excruciating pain because it had become arthritic much more than it would have sort of on its own. And so since I knew about the joys of joint replacement, I asked them to do a knee replacement and they agreed. But that was a much more difficult surgery and recovery and things like that. I still have pain in it, but it's better than it was back then. So I guess like this is really, in some of the research that I was doing, I guess it was sort of later in life, even though I sort of could see some trends between, again, the symptoms and the stress and things like that. The concept of root causes wasn't really something that I understood until later in life. And that the identification and treatment or lack thereof with the arthritis was very eye-opening and causing me to kind of fall further down the rabbit hole. And one of the things I noticed was, for example, certain foods that I would eat. I would immediately feel more swollen, more puffy, more in pain. And so I would sometimes ask the doctors about it. And many of the rheumatologists would tell me I was crazy, that there was no correlation. I met a few that eventually sort of acknowledged that. And I know that, that's potentially a trigger for some people, but it really got me to understand that, a diagnosis is just about the symptoms. But the digging deeper about the root cause, what is causing this, is really the important question to ask. So, from there, I started learning more about nutrition. I mean, I was a we grew up on a farm. We had our own garden. So I ate a lot of healthy food as a kid, but I didn't really ever think about it. And then, really the rabbit hole is just all things nutrition, supplementation. We talked about sleep, exercise. I mean, again, I have a lot of limitations, so I kind of just try and do what I can. But I think now the biggest component for me is the mind-body connection, because I think that without that particular part, it's almost like the top layer. And so until you sort of deal with that and remove that, whatever else you're doing really can only have so much of an effect. So again, even though I sort of, didn't want to be on medications and stuff, I still had to function. And so the last sort of drug that I was still taking, and I was sort of doing it on my own, and just like, long story short, I was getting it from Serbia, where my ex-husband was from, and it was very cheap. I didn't have to go to a doctor. You could just walk into a pharmacist and get it. So I was taking prednisone. And it was something like my dad, who's a dentist, had actually sent me a book about people with arthritis that have low cortisol. And like, that's something we talked about. But so I was like, sure, let's try this. And I was getting some relief from it, but there was a lot of side effects. One of them, my immune system was even worse. I was bruising all the time. And then for me, I mean, I'd always been kind of a healthy, in shape, not like strong athletically, but I was, sort of a petite child and even an adult, the weight gain. And also, I was just like thirsty and hungry, and I felt sweaty. I just did not feel like a human. And not everybody gets this, but I got what they refer to as moon face, where my face just was like puffy. At some point, I didn't even look like myself. And so I think all of that, and probably like, thank you for my vanity, I decided I couldn't live like this anymore. Because I just felt terrible. Like I was just uncomfortable in my own body. And it wasn't even just the weight, it was the way the prednisone made me feel. And so I decided to get off it. But I wasn't seeing a rheumatologist, because I think the last one that I went to helped me a little bit. And then at some point he was like sick of me coming in and said, unless we start giving you injections of different things, I can't help you. So I had to stop seeing him. And so there was no doctor that would help me get off these medications. And so I just decided to do it myself. And so I thought that I was weaning slowly. I thought I was cutting back slowly, but I guess because I'd been on it for so long, my body kind of went into shock, and the pain returned in a way that like I could barely function. I had to actually take painkillers for a portion of it to kind of wean off the prednisone. And I was doing this all by myself because, again, if I went to see a doctor, they didn't really have a solution for how to handle this. And so it was to the point where it was about 9 months where I was so weak, I could barely get off the couch. I just felt like I was going to take a breath and just die. It's like, I know it sounds crazy that I didn't go to a doctor, but they didn't know how to help me. And so then at one point, I started getting itchy. And when I say itchy, it was like my skin was crawling. And so I filed my nails really sharply, and I was scratching, and I had marks all over my body. It was so bad where I could barely take a shower because the water would aggravate me. I could barely wear clothes. I would get up in the middle of the night. If I would get a little bit warm, the itching would get intense. And I used to just go stand in the kitchen naked in the middle of the night because I was so uncomfortable. And this went on for months. And finally I said, I got to go to a dermatologist. Maybe someone can help me. So I went to a dermatologist. The first thing he said was, do you think maybe it's scabies? I was like, first of all, do people even have this? Is that a thing? Like, I don't think that's what it is. And then he said, well, maybe because I had marks all over me from the scratching, because I was literally clawing my skin. He said, maybe you have bed bugs. And I was like, I don't think so. So I went home and checked my mattress. I did not have bed bugs. And then I went back to him and he said, well, we could put you on some cortisone, prednisone. And I got up and I left because, just as a reminder from 5 seconds ago, I was trying to get off.
You didn't leave after scabies? You left after prednisone?
I think I was just in shock because I was like, scabies? Even because then that's how I knew he couldn't help me, right? When he was circling back to the thing that I wanted to not be on anymore. And so I just kept going through this by myself. And eventually I started getting a little bit stronger and feeling better. But I couldn't go anywhere by myself. Like I wouldn't even go grocery shopping. I think I was using Instacart well before COVID because I was afraid that I'd be standing in line and I would pass out. I was just that weak. I mean, I slept on the couch for months because I didn't even have the energy to go into bed. And I would wake up in the middle of the night. And so I would have to watch TV. Looking back, I'm not actually sure how I got through it. But it was one of these things, I guess, there was something in me that knew I had to. And even though nobody could help me, I just sort of had some kind of faith that it was going to get better.
So to be clear, this is all you think from prednisone and weaning off of it?
Yeah.
Okay.
Because I think it was like, and all of the medications that were in my system over time that never probably had the ability to detox. Because it gets into your cells, right? And so I think, And during that time, I saw different, like I saw a hypnotherapist. So at that time, I had gone to a chiropractor. I'll sort of talk about this in a bit, but I went to a chiropractor and I explained about not because of the itching, but it was a symptom I was having. And so she had me go to a hypnotherapist, what I keep saying, a hypnotherapist to kind of try and like help me get out of the itching. But I think that probably what it was my liver detoxing, which can come out through the skin. So I didn't have any visible rashes, but there was probably some nervous system activity and all kinds of things that were just causing this skin crawling sensation. I can't tell you because nobody knew what to do with it. I mean, at one point, I think I went to one doctor who gave me some blood tests and told me I had high cholesterol, which is another hot topic because people who have inflammation have higher cholesterol numbers. I'm a vegetarian, so it was not anything that I was doing in my diet that caused that, but again, another topic. So yeah, I mean, that was just, I don't know. I somehow just had to get through it.
Do you think people who have done the same thing, who are on prednisone and have weaned off it, would share any of those symptoms you had, or is yours just so severe? Do you know? Are there groups for that? People?
I have no idea. I didn't even know what to do. It was a weird thing to research, right? And again, I was only taking like 10 milligrams. I wasn't on ever high doses of it. I thought I was cutting back slowly. I think it was just my body sort of, and I don't know that these are all detox systems. There's something that I always sort of knew about. And maybe this is what kept me going, that sometimes when you have a healing event, it gets worse before it gets better. So I think in my head, I clung to that. I had some guy I forget what kind of alternative medicine he practices, but this was like where kind of supplementation started. I mean, he was spending insane amounts of money on supplementation and all sorts of different mud treatments he was doing to try and detoxify me and whatever. And none of it really ever helped. I kind of just more felt taken advantage of because I was so desperate for some kind of relief. And it's not like where you can look up and say, well, your symptoms are going to last for this long. I didn't know where the light at the end of the tunnel was. I just knew I'd gotten that far. I couldn't go back.
Got it.
And then also at that time, and this was why I had gone to the chiropractor, one of the symptoms that I had was in my back. And I didn't originally feel pain in my back. What I was feeling was, it was almost like I was doing a hamstring stretch when I was just sitting or standing. And so that became concerning. And so, I went to a chiropractor and she did some work on me. Nothing ever really helped. And so she had me go and get an MRI. And just as a side note, if you're claustrophobic, MRIs are not a good time. I got in there, I made them pull me out, and then I had to hold my breath, and they pushed me inside.
I'm on the other spectrum of that. I've taken a bunch of MRIs. I literally fall asleep. I've literally taken a nap at an MRI because I just close my eyes and I refuse to open them, which I get.
Yeah.
But literally have fallen asleep, and then it goes dun, 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 and I'm still sleeping.
Okay, well, I'm jealous because I think if someone ever told me now I needed an MRI, I would probably just run away and just deal with whatever the problem was and not get it, because it was just, for me, it was horrible.
MRI is effective? Have you ever done those, or?
I only ever had the one, and it was very much not open.
Okay.
So I don't know. I just remember they put me in and I was like, this will be fine. And then I made the mistake of opening my eyes, and it was as though somebody had made me dig my own grave and shove me in there, and I could hear them shoveling the dirt on it. So anyway, I not recommended for anyone that has any sort of semblance of claustrophobia. So the long story short was that once I got the MRI results, they had me go to a spinal surgeon to read them. And I remember I was sitting in the room waiting, and this man walked by and he looked in the room, and then he looked at my chart, and then he looked in the room again, and he said, "Is this Sandi?" And I said, "Yeah." He's like, "I was expecting to see an 85-year-old woman." Okay, well, that's weird. So then he explained to me that he looked first at my MRI and I had the back of an 85-year-old woman. So that's when I first heard the terminology severe spinal stenosis, which, you can Google it, but it's basically like a compression of the spine. It's like pushing on the nerves, and it's just all messed up inside. And so that was why I was feeling this problem in my legs. And I did have some back discomfort, but it wasn't that bad. And I don't know, this will go back to the arthritis as well, but especially for someone who's had a lot of health, problems, a diagnosis is a blessing and a curse, because for a minute you feel relief that finally somebody has diagnosed something wrong with you and you can point to it and it makes sense. And again, the spinal stenosis was another one of these really aggravating diagnoses where I was told that there was nothing they could really do. They didn't recommend surgery. They had me, the chiropractor had me do some core training exercises. But I remember that day when I got home, I sat in the car and I just cried, because I think I was in my mid-30s, and basically I was being told again I had another potentially debilitating condition that there was really nothing they could do with. She gave me this, the chiropractor also gave me, I had a Nissan Z. It was like the bucket seats at the time. And she told me that was bad for my back. So she gave me this weird back support thing. And so this diagnosis, well, it gave me something to say that I had. I think it then tunneled its way into my brain, and it was all that I could think about, meaning that whenever I would feel something, I could almost visualize this spinal stenosis. And I think that can be again, we'll talk about this with the mind-body episode or episodes. It almost like it created a visual and visceral reaction for me because I could point to it. I was like, oh, it's the spinal stenosis. And it made sense. And it told my brain that there was an actual problem. And so that was just how I lived.
Well, to be a part of Health Hunt, one of the qualifications or pre-qualifications is you have to have spinal stenosis, because that's where we both cross paths for sure.
Well, I think it turns out, again, this is mind-body stuff, but I think a lot of people have it. And the argument is that you can have, bulging discs or spinal stenosis and things and have no symptoms, whereas somebody else could have the exact same MRI and have all of the symptoms.
Yep.
So that's where we start looking at what are the other causes. And the other thing with the diagnosis is that especially when you're suffering from whatever it is, when you have a diagnosis, you can tell other people about it. And so then you don't feel so crazy. And that's where people start to be more understanding. When you're just not feeling good and nobody knows what's wrong, it's a harder thing to for anyone to wrap their head around. So again, it's good and bad. So sort of in that vein, and because of the things that I've learned more recently, I'm trying to separate myself from a diagnosis, because typically I would say my arthritis or my pain. And when that happens, like the arthritis, since I've had it, has become part of my identity, right? Even though I don't really like to talk about it because I don't want people to feel sorry for me, sometimes I have to bring it up because I'm in pain and I can't do things on a functional level like other people can. But I think that I have clung to it in a way where my brain and body has learned that it's just our thing and it's going to be there. And so I'm trying to use different language so that I don't call it my arthritis, or even use the term arthritis, because it's such a catch-all for chronic pain and inflammation. It's almost like it doesn't have a basis. And so it's important to me also with the spinal stenosis. And again, there's a whole other story in this, and that recently I had sort of a very emotional event and I sort of quote unquote threw my back out. And the pain was worse than any pain I've had in my entire life, like to the point where I was screaming. I've never been in the kind of pain where I literally was screaming. And so I lived with that for a couple of days. And then I remembered some mind-body book and I listened to that. And long story short, that back doesn't really bother me anymore. A little bit here and there when I feel stressed. But again, this will be a whole other episode. So I think it's important that I'm really trying to sort of take a step back from anything that's been diagnosed or anything that I identify with, to be able to sort of release it from my identity. And something else I learned, because, we sort of talked about the chasing health. Obviously, I still have, again, I am not cured, and I'm working on getting better through a lot of this mind-body work that I'm doing, but I'm not there yet. But I also have to sort of understand that I'm a human being and there's no end point to being healthy, right? I mean, you're constantly looking for things that will maybe optimize, whatever you're feeling at a given time, but there's no date where you're like, I'm 100% healthy and I'm going to stay this way until I die, or maybe I won't even die because I'm so healthy, right? Like that's an important thing. So death notwithstanding, you're always going to live in a human body and you're always going to be on a health journey. So I think reconciling that there's really no endpoint makes it easier to sort of exist in the now. And that's another point that's important in terms of just feeling better. And, I always have to have realistic expectations, but also a healthy dose of optimism and a lot of curiosity with whatever I'm trying next. But like Dan and I talked about a little bit, it's important that I for me, probably for a lot of people, that I'm not in a constant state of chasing the next thing. And, when you're in chronic pain or have chronic symptoms or whatever you're feeling, it's easy to get into that cycle. So.
No, that's really interesting. I think we're very much into being advocates for our own health, both of us. We are clearly works in progress. You are never going to feel perfect all the time. It's just not going to happen. Maybe when you're younger, you can bounce back quicker, but I've come to grips with that. But I think we've had very different but similar journeys. And I think a lot of what I've talked about is kind of, you're seeing it in articles and you're seeing it it's very much in people's faces. I think much of what Sandi is talking about is super interesting. It's also being in articles and stuff, but I don't think people realize how important it is yet. I think it's the next wave that's coming. And so I think it's going to be really important to understand and see the episodes that we're going to curate around what she's the mind body.
And I think it has, it has a stigma because it's not about you made it up or whatever it is. There's an actual scientific connection between your brain and your body and sort of how it all links together. So I want to be careful about suggesting that it's, that people don't go down a rabbit hole of thinking that it's, something you manifested or you're hysterical or whatever else it is. I mean, it's a very real thing. And I feel pain the same way I would if someone stabbed me with a knife, which I hope will never happen and I have not experienced, but as a point of comparison. Before we wrap up, I just wanted to say that the last 2 episodes, my story and Dan's story, were a little bit longer than some will be. But we felt it was important to start here. We want you to really understand why we're doing this and how our own experiences brought us to this place. This podcast is about real talk, real stories, and hopefully real solutions. We're not the experts. We're the curious ones, the ones still learning. So as we keep going, we'll be bringing in people who can help us and you make sense of the noise, find what works, and feel a little less loss in the world of health. I also really wanted to say thank you for listening, for caring, and for staying with us, and mostly me today, through the messy parts. If you're in your own difficult season, I hope this episode reminds you that healing is not a straight line. It's a conversation with your body, and you're allowed to take your time and give yourself grace. Now, we would truly love to hear about your story or any of your questions. You can reach us by email at info@thehealthhunt.com or come say hi on Instagram or TikTok at thehealthhunt_podcast. And if this episode met you where you are, the kindest way to support the show is to follow, rate, and share it with someone who could use a little company on their health hunt. Thank you for being here. Be gentle with yourself, and remember, health is a group sport. See you next time.